The Unfiltered by Jade.
Jade.
Welcome to the Unfiltered by Jade, where we get out of the box and dive into topics that are sidelined. I look forward to entertain, educate, and inspire. Feel free to like, share, subscribe, donate, and make everybody know about this.
Beats by RB Records.
Shopping assistance, your style, your budget. Our services include online and local shopping for individuals and businesses, personal shopping, purchasing of company and office supplies, importing and exporting small packages across Jamaica and worldwide, and helping you find unique gifts and items for all events and occasions. Contact us at 876-919-5195 or shoppingassistance2015@gmail.com. Shopping Assistance, your style, your budget. Welcome to the Unfiltered by Jade. Today we have with us here Dr. Beth Goldstein, and she's here to speak with us today about hyperpigmentation. Now, Dr. Beth, this is an interesting topic because this is something I also struggle with. So I'm waiting to hear what you have to tell us about it. So first and foremost, what is hyperpigmentation?
Good to be back.
Sure.
Great speaking with you. So hyperpigmentation is due to excessive melanin production. And it is, everybody has like the same number of melanocytes, but that the melanin that is sent over is usually caused by increased synthesis, and that can be due to lots of reasons.
What are some of the causes? What are some of the reasons for this?
Well, there can be just like some extra deposits of pigment in the skin, things like birthmarks or freckles. There's some genetic syndromes. But with just, normal flat areas, the most common tends to be either what we call post-inflammatory hyperpigmentation, like after a pimple or a scratch or a bug bite or burn. Due to inflammation, there's increased pigmentation, and it can be in the top layer of the skin, the epidermis, but sometimes it's also in the second layer of the skin or dermis. And that's when it's really stubborn to try to get rid of. There's also splotchy excess pigmentation, like with melasma. It is present in men and women, but is classically associated with pregnancy and birth control pills, but anyone can get it actually. There's some medical conditions that can be associated with it, and certain medications that can do it. So even diabetes or some other endocrine abnormalities, like with your pituitary and your thyroid, even some blood disorders can cause you to have excess pigmentation.
So when is it that you know if it is benign or if it's malignant?
So we usually think in terms of, benign being it's no problem whatsoever. So for instance, the hyperpigmentation associated with, say, diabetes or thyroid disease, the pigmentation itself is not going to cause you trouble, but the underlying cause, can cause you a lot of illness. As far as, skin cancers from pigmentation, which we call those melanomas, although you can have pigmented basal cell carcinomas, they can have some pigment to them as well. So pigmentation, like in your nail beds, if it's irregular, a lot of people who are Asian or darker skin types can normally have some hyperpigmentation in their nails and on multiple nails. But sometimes that can be a sign of cancer if the pigment looks different from the others or is changing, getting darker or whiter or multiple colors.
So there are different types. You mentioned the one around the nails. There are some who have it like around the neck or on the arms.
How do you know? Because sometimes there's no symptoms. I mean, and some persons who probably have gone to get it checked out, they're like, there's nothing wrong with them apart from that. Like, what do you do? Like, after you use the over-counter medications, when
Mhm.
is it that you need to now go and seek help? Because I've heard of using papaya soap, using whatever to get it, but I think using those things more, it's more to clear up the skin to make the skin look better, but not heal the problem or get rid of the problem that's there.
Now, there was one problem. It looks like dirt. It's called terra firma form dermatosis.
Hmm.
And I have seen it, and it looks like just dirt. And people are really clean, but that is actually due to the skin not exfoliating. Like the top layer of the skin gets kind of thick, and it doesn't
Hmm.
exfoliate. And sometimes use of alcohol scrubbing once a week can help with that. But in general, hyperpigmentation, say we were talking about around the neck or under the arms, sometimes that is associated with a tendency for diabetes or we call acanthosis nigricans. And that's usually located like under the arms, in the groin, on the back of the neck. And that
Mm.
is really not excess melanin. The darkness is usually due to thickening of the very top layer of the skin. And
Mm.
treatment of that is, getting rid of the underlying, if there's like diabetes or obesity or some other things that are maybe aggravating that.
Mhm.
But there's no papaya soap that's going to help with that. Um, General exfoliation is kind of the best way to go. There's over the counter, the more you try to, really scrub things off or rub things off, you're almost like running in a circle because you're inflaming the skin, which is going to cause more darkness, which is going to cause more inflammation. So trying to do things that are aggressive are not a great idea. I'm particularly not rubbing, rubbing the skin or scrubbing the skin. So products that have ammonium lactate, one called amlactin is over the counter, is a good one. There's a number of glycolic acid lotions. You don't want to be doing peels, but just lotions if you're talking about on your body.
Okay.
And those can be helpful. In areas where there is sun exposure, even darker skin types, one of the things that really can keep some of the hyperpigmentation going is sun. And sometimes it's actually visible light, not just ultraviolet light. So often, if you're fighting hyperpigmentation on your face and you have darker skin types, sometimes using even sunscreen with pigment in it is better
Okay.
than just regular sunscreen. And then there's, medications that can cause, hyperpigmentation, certain antibiotics and high blood pressure medicines and things, heart medicines that sometimes can aggravate it.
So does apart from medications, etc., does diet affect hyperpigmentation?
Not so much. Not really. It's more, there's this one condition where you can, if you get certain food on your skin, it can cause hyperpigmentation and blisters. And that has a special name. It's called phytophotodermatitis. So it's a lot
Mm.
of syllables.
Yes, it does.
But if you've ever been squeezing limes and you get it on your fingers, but there's lots of other foods that can do this, but if you get lime or celery or certain different type of vegetables on your skin and then exposed to the light, sometimes it can cause blistering and hyperpigmentation. So not
Hmm.
necessarily eating food, but having it touch your skin.
But Dr. Beth, persons have suggested, oh, this is just what we have been hearing. Persons have also suggested using like lime or lemon with baking soda to use to rub on it to help it to get away. I'm just telling you. So now that you're saying that the lime or so we touch the skin and the light goes on it, it can cause hyperpigmentation. That means we're probably making it worse than better.
Yeah, and there are some really, good treatments, and the treatment of hyperpigmentation, can be so frustrating for people because sometimes you're managing it You're not curing it and making it go away forever. Like, you make it better.
Mm-hmm.
And then again, we're talking about, you've got to really stay away from things that are going to cause irritation or inflammation, because that's really going to go against what you're trying to achieve.
Mm-hmm. Mm-hmm. All right, so we know about the one on the neck, as he has spoken to us about. The one under the arm. Can using certain deodorants help to cause this too?
Usually if it is irritating. So if your deodorant's not irritating your skin, probably is not causing the hyperpigmentation. But some people just get hyperpigmentation under their arms. It's just a thing. And that's where
Okay.
you can use some of these gently exfoliating products. You can even use a very mild form of tretinoin. There's some
Okay.
over the counter. Aven makes one called Retrinal, Retrinal, Retrinal by Aven. And
Okay.
it's very mild, gentle form of vitamin A cream that can be very gentle to help with hyperpigmentation in that location. If just, the alpha hydroxy acids aren't helpful or too irritating.
You have told us already about some of the medications or the remedies that can be used, but what is the procedure that will take if it is that we go to a dermatologist and they say, okay, we need to treat this? What is it?
Okay, I'll talk about procedures, but there's a lot of other skin lightening
Mm-hmm.
options for people. So we'll talk about, with hyperpigmentation, again, we have to be so careful to not irritate the skin. And I had a patient who had laser for her melasma. And one time it worked, it was great. And the second time she had it done, it was a disaster. And she said, I'm not in the sun. And this was several years ago. And what we realize now is that she was not using, the tinted moisturizers. And she was also, heat sometimes makes it worse. People can be great about using their sun protection, but just heat sometimes can make it worse.
Yes.
You can imagine if you're using a laser, they're hot. And it's not a guarantee that going with more aggressive or fancier procedures is actually a good thing.
Hmm.
So
Okay.
you're not you're not short selling yourself to not have these extensive laser treatments. Chemical peels, starting gently, can be helpful.
Okay.
Microneedling can be helpful. There's now use of products that have tranexamic acid, which can be helpful. So sometimes you can have microneedling now. They're starting to find formulations of tranexamic acid
Okay.
that can help with the hyperpigmentation. Oral tranexamic acid has been shown to be very helpful with melasma.
Okay.
And that's where you end up. It's not where you start. There are some side effects, but
Oh
it
boy.
tends to work well. Have you heard much about hydroquinone? Have you read or
Not
seen?
much about it, no.
So hydroquinone has been banned in many places around the world. And in the US, with the CARES Act from COVID,
Uh-huh.
kind of strangely, they outlawed over the counter bleaching agents, which was
Mm,
primarily the 2% hydroquinone agents. And
mm.
rarely, really rarely, particularly with higher concentrations, it can cause deposition of black pigment in the skin called ochronosis. And there's some maybe association with long-term use with cancer, maybe. So that was really pulled back. But the combination of tretinoin and a steroid cream along with hydroquinone is really effective.
Okay.
But the idea is it's not a chronic treatment. Just use it, and once you're better, you switch to non-hydroquinone agents.
Okay.
And there are a lot of really good ones out there that can be very helpful, particularly for maintenance. One of my favorite ones is azelaic acid. You can get it by prescription and over the counter.
Okay.
It's very effective for not only acne rosacea, but regular acne. And it also helps with hyperpigmentation. So if you have acne and hyperpigmentation, it's a great option along with a mild retinoid. Because back to, I just say the same things over and over again.
That's fine. That's fine.
Vitamin A derived treatments are very good, But if you have a tendency for hyperpigmentation, you have to go really with the less irritating products. Over-the-counter products such as those containing kojic acid, niacinamide. There's actually one, it's a little pricey, but it can be very effective, called cysteamine. That can be very helpful. But if you're not decreasing the irritation and decreasing the new inflammation, as well as using good sun protection, you are chasing your tail, because
Oh boy.
we tend, to people to understand, you manage hyperpigmentation. You don't cure it. But if you have
Wow.
that acne, and you get the acne under control, then you're in pretty good shape.
So even if you have the hyperpigmentation on your face, you still use those same things on your face, not just your neck or your back or your hand, but you can use it
Oh,
on your face
absolutely.
too.
Yes. I'm sorry. These are in particular for your face.
Okay.
In particular for your face.
What about the invasive versus non-invasive treatment?
So there are the chemical peels there's the microneedling, which can be helpful in addition to adding certain ingredients that help to reduce the hyperpigmentation. So the microneedling, they make tiny, tiny little holes all over the skin on this grid
Mm-hmm.
that they're making these tiny holes. And so they can get some of the medication to penetrate a little bit deeper in the skin to
Mm-hmm.
help with the hyperpigmentation. Chemical peels, and again, going slowly, because if you're using anything that creates damage that's not super controlled, it's just going to make it worse.
Yes.
You have to really be cautious. And then laser and light therapies, there's one called intense pulse light, which means it's a broad range of light. It's not just one wavelength of light. That's why we call it intense pulse light.
Okay.
And that could be very helpful. But again, it's heat. And so we don't really use it in darker skin tones. In lighter skin tones, it's much safer.
Okay.
Pulse dye light, which is a gold standard for blood vessels and can also help. Some people have melasma, and there's a vascular component, and it can help with that. And then there's other lasers, one called Q-switch neodymium YAG laser can be used. But I just, over and over, like, you just have to be really, really
Really careful.
careful.
Mm-hmm. Mm-hmm.
If you have melasma in the second layer of the skin, sometimes you go with a non-invasive laser that can help get that deeper layer of the skin. There are some birthmarks. One's called a nevus of Oda,
Oh
and
dear.
you can use a laser to help get rid of that pigment in the deeper layer of the skin. Sometimes people can have those big birthmarks on their face.
Mm-hmm.
Those lasers, the birthmarks kind of look almost blue, and
Yes.
the lasers can really help with those.
Okay.
And the target is deeper in the skin.
Would
But
that
I,
be?
I wouldn't rush to do anything that creates heat on the skin.
Yeah.
I'd say more with microneedling, gentle peels. And if somebody's just going to do one peel, that's not usually going to help. So it's better to do multiple, less aggressive peels than to try to get everything done in one peel.
With doing this is because you say we have to do multiple to get rid of them, especially like for birthmarks.
So for birthmarks, you're going to have to do a procedure like a laser,
Oh boy.
because
Okay.
that's fixed tissue. It's not just excess pigment. So that's actually from cells themselves.
Okay. Okay.
Birthmark.
Man.
Now, if you've got a spot that you're worried about for cancer,
Mm-hmm.
so that would be a flat or raised mole. It can be any color that's changing or evolving. Size, shape, color, texture, feeling, asymmetry, irregular borders, any change in a mole. And you don't want to wait to hurt or bleed or bother you. It's always really the way it looks. And that they can really occur anywhere. They can occur in the mouth, in the groin, hands, feet,
So you really just
non-arms,
have to be looking.
anywhere. Mm-hmm.
You really have to just be looking. Um, so for this is something that I've heard people ask before, people question, because the truth is a lot of persons are afraid to go to the dermatologist because of the costing.
Oh.
So
Mm-hmm. Yeah, that's real.
so Like, how much is it that will cost to get the laser done, or the invasive versus the invasive treatment, um, and to figure out how to do it. Because hearing that you have to do sometimes multiple peels, people hear a lot of money. So people would
Mhm.
prefer to go on to use the quote unquote bleaching cream to try and get rid of it than to go to a dermatologist to try and figure out what's happening.
Well, I will say that sometimes it's hard to get in to see a dermatologist, and it can be expensive. And
Mm-hmm.
sometimes insurance, covers things well, and sometimes they
Mm-hmm.
don't. So
Mm-hmm.
you're spot on.
Mm-hmm.
With spending a lot of money and being very frustrated with treatments that don't work, to go in for a one-time visit just to talk about it and get yourself on some good products, prescription or non-prescription. The over-the-counter bleaching creams have actually been found to also contain mercury, which is very dangerous.
Wow.
So just getting things, oh, it's the best thing from, the Far East, it works. Well, it works, but, it can also be very toxic to your body.
Right.
So it's better to go in, say, for instance, if you have hyperpigmentation and you go in and you get recommendations of how to protect your skin properly, as well as get a prescription for a very effective medicine
Right.
that you don't often need a procedure. Like a procedure is where you end up, it shouldn't be where you start.
Okay. Right.
And you want to choose a provider who has an interest in helping you,
Mm-hmm.
that, oh, it's not cancer, you're fine. We're like, okay, it's not cancer, but I want this treated.
Yes.
And dermatologists are well versed in how to help people with hyperpigmentation. But if you're not improving, to talk with your provider and say, hey, how long should I give this? And how can I let you know if I'm not doing better? So a lot of us now have these patient portals, so you don't have to go in every time,
Right.
or to go in and say, I really want to understand, take notes, and get a stepwise. So certainly procedures like chemical peels can run anywhere from $150 to $300 each.
Okay.
Are there packages? Are there, lasers do tend to run more like $500 to $1,500 each. But
Mm-hmm.
again, for hyperpigmentation, that's the last resort.
Right.
With even oral medication, the tranexamic acid, if you have really bad melasma, and it's actually not a real expensive medication.
Okay. Okay.
So to go in for an office visit with a dermatologist, you can certainly shop around.
Okay.
For things like hyperpigmentation, sometimes you can start off with, one of the telemedicine platforms that make sure you're seeing a dermatologist. If you're worried about a skin cancer or a spot or a mole, I have just launched Modern Ritual with my daughter, which is an
Mm-hmm.
at-home spot check for skin cancer. So it's a screening for skin cancer. It's not a diagnostic, but from your home, you can order a kit, upload a photo, and within 2 business days, you can find out from a board certified provider how likely that spot is for cancer and how concerned you might need to be.
Nice.
And it's about the cost of a copay.
Nice.
So that is an option. And we are expanding into other states. We're in North Carolina now, but we want to have skin cancer screening accessible. So, do you need to take off half a day of work to go in and find out if something's cancer? Well, if you do, you
Mm-hmm.
do,
Yep.
but it's hard to get in. And if you really need to go, you'll go.
Mm-hmm.
But this will let you know.
That's very nice. Congratulations on that, Dr. Will.
Thank you. We're very, very, very excited. But I think for people, you can spend as much as you would at the dermatologist wasting your money on products and ordering things online. And there are some really great products out there, but understanding the step approach.
The thing also is that we don't want people to just buy products and it's not going to work for them. So
And
it's
sometimes it makes you
really,
worse, if it's
yeah.
irritating.
Because I mean, we're just looking we're just buying stuff, looking on YouTube and just buying stuff. I mean, or just using stuff and trying to figure it out. Also, um, I've heard persons say the hyperpigmentation can start from PCOS. I'm not sure.
Well, a lot of times with PCOS, I would think it's due to a couple of things. One is the acne that sometimes comes with PCOS. Sometimes you have what's called metabolic syndrome with it. And so you have a tendency to have diabetes, and the things that come with diabetes, like acanthosis nigricans, which we talked about, is actually not pigment, but
Right,
it's a buildup of the top layer of the skin of the skin cells, which
right.
can sometimes be helped with things like amlactin or glycolic acid or gentle products like that. So the acanthosis nigricans, as well as a lot of times women with PCOS are dealing with excess facial hair and neck hair, and they're plucking and doing different things that can certainly lead to hyperpigmentation scarring. So we could do a whole nother segment on hair removal.
That sounds good.
For sure, for
That
sure.
sounds
So
good.
with PCOS, it can definitely be, multi-pronged as to why you have to deal with hyperpigmentation.
Yeah. I mean, this is something that I'm sure other people would want to hear about because I've heard many people talk about it before. It's something that troubles many. But there are times we just leave it alone because it's not troubling us. If it's not troubling us, why? But then again, it bothers people, especially like when it's on the neck or on the face. It's very visible, so it
And
bothers
if
you.
you're and if you're using methods that are leading to scarring and hyperpigmentation and ingrown hairs, that's tough. And some people get keloids from trying to do that. And I've seen some real difficult cases where people have been trying to deal with this hair, and whatever they're doing is creating so much scarring.
Oh boy.
Yeah.
Okay. So the best thing that we need to do is to go and see a dermatologist and figure out the way
There's
from
so
there.
many treatments. I will tell you on TikTok, I've been on there a lot more.
Hmm.
Um, to look at the dermatologist, we actually have really good information. So to follow actual dermatologists on TikTok,
Yeah.
we've all
Yes.
posted about melasma and hyperpigmentation treatments. We're not holding back.
Right. You're going in because I've seen some of them. So you're going in with them.
Really, not just this, we're not just sitting there and disapproving of the misinformation. We're also trying to add knowledge for people so they'll understand there are really great treatments out there. There's plenty of over-the-counter treatments for hyperpigmentation.
Yes, we just need to speak to somebody about it and somebody who knows, like a dermatologist.
Yeah. And then, to look at our information, things like niacinamide, azelaic acid, general use of glycolic acid, over the counter Retronal, even Differin, all those can be very helpful.
And
But
even
you need
the
to know what you're addressing.
right, and even a glycolic that you spoke about. Can people use that just the oil? Because they sell the oil like the serums. I've heard persons talk about using the serum oils, the glycolic, but I'm not quite sure if just using that alone itself.
Well, it needs to be a whole program. It has to have sun protection and light protection, and again, the visible light protection for hyperpigmentation. So if you're
Oh,
not doing that, you're never going to get better.
oh,
And if
oh
you're
wow.
only doing that, you might get better with just that.
Mm.
And if you have hyperpigmentation on your neck and use things like a mild Retronal and the glycolic acid, those are all over the counter. You don't need to see a dermatologist to try to start using things like that,
Okay, sounds
as well
good.
as niacinamide and kojic acid. These are all over the counter. Licorice root,
Hmm,
soy.
really?
There's a lot of good over the counter, but you need to know what you're dealing with.
That's a
So,
problem. So we still can't buy them then. We still can't just buy them because we really don't know if it's a root problem or if it's just, the dermis or epidermis. We don't know where it is. So we still have to go to a dermatologist then before we can just start buying stuff because we're either going to make it better or make it worse. And we're not quite sure what it is.
right. Well, if you're sure you have acne, you can start with a good over the counter product like that. And if you're sure you have melasma, then you can start with, a great sunblock. a visible block. And I will say for melasma and a lot of hyperpigmentation, you'll get a lot better results in the fall than you will in the summer.
Oh, wow.
You can at least try to maintain in the summer with your really great tinted sunblocks that are SPF 30, broad spectrum,
Right.
really protective.
Okay. That sounds good.
So I don't want to say you have to go to a dermatologist. No. There's plenty of good stuff.
Okay.
But I am saying, yes, you have to know, at least have a pretty good idea of what's going on. And the
Okay.
electrician will tell you, what you're talking about, like your neck. You probably need to get checked for diabetes if you're having, a lot of thick, dark skin around your neck and some other symptoms, and that may lead you more towards needing that
Okay.
evaluation. So a sign of systemic disease, not just hyperpigmentation, but a real sign.
Right. Understood. Man, thank you. Now I'm going to do some research on my own to figure out
You
what's
can always
happening.
ask me a question. You can always send me a question.
I will definitely do that. Oh my goodness. So, thank you so much, Dr. Beth. Can you just tell us where to find you?
I can be found at modernritual.com, modern ritual.com, and Derm Dr. Goldstein on TikTok. Please follow me.
Yes.
Please, at Derm, DRM, Dr. DR Goldstein, Goldstein.
Nice. Thank you so much again, Dr. Beth. I truly enjoyed this. This one I enjoyed also. I enjoyed very much. Thank you so much for sharing with us. There's a lot of information that you gave. That's very important, and I'm very sure a lot of persons will benefit from it. So thank you so much.
Absolutely. And I'll send you some information if you want to put up there about
Sure.
Treatment as
Sure.
well.
No problem. I'd appreciate that very much. So thank you again. And thank you again for listening, guys, to Unfiltered by Jade. And we'll be back next week, Tuesday. Thank you.